As many of us know, there are a lot of areas in the state that are underserved when it comes to medical care. But one university in Georgia has been fighting the good fight for more than 30 years, making a significant change for residents that need a community physician. If you live in the rural area of Georgia, it's no surprise to you that a physician shortage continues to prevent some residents' access to consistent medical care. One leading university in Georgia believes there is hope.
Well, one of the things that we do is that we require them, the students that is, to participate in 10 weeks of community medicine experiences in rural and underserved areas of the state. So we put them in places where they can find out what it's like to be in the community. We do have rural scholarships. We partner with the state of Georgia. So physicians in training who would like to have scholarship money, all they need to do is commit to going back to a community after their training, and almost all of their medical school debt can be relieved.
A recent Georgia Board for Physician Workforce report highlighted some promising trends on doctors practicing in the state. And Dr. Gene Sumner of Johnson County, a graduate of the Mercer program, believes there is real value in practicing in smaller communities.
Well, the presence of a physician in a community is an economic development tool. You need to establish a system of access to care that allows industry to locate there and allows families to live there and be healthy. So we don't need to do everything. We need to do what we do as well as anybody. But we need rural health and rural health access in every community. I think it's vital to growth. I think it's vital to the wellness of the community. I think it's important in terms of health status.
One of the current students enrolled at Mercer's Med School, Chris KIKER, he's planning to graduate and share his experience in a rural setting in Georgia.
Number one, calling, and number two, your lifestyle. And I'm from a small town. I understand people from a small town and what they go through on a daily basis and how their health and their health care impacts their family and their job. So I have a calling to go back to a small town and work with those people and be a part of the community. And then lifestyle. I love the small town life. I love knowing everybody. I love being a part of community. And I want to have some land and farm and have that lifestyle. So the two things is calling and lifestyle.
Dr. Jacob Warren, director of the Center for Rural Health and Health Disparities in the School of Medicine, conducts research specific to helping areas of Georgia that are in need of medical staffing.
I think part of it is exposing them to what actually happens. Some of the most productive things I've seen happen are when you go down and show someone what's actually occurring and how far it would take someone to get to a primary care physician, or for a lot of, say, childhood obesity initiatives now focus on complete street initiatives, and you can take them down and show we're talking dirt roads. You know, we're in different places of the conversation, and so actually showing them, I think, is the best thing we can do.